right, hello. Welcome to our webinar today. I really appreciate everyone joining us. It looks like we have quite a few people online. My name is Barbara Kowalczyk, and I am faculty at The Ohio State University in the Department of Food Science and Technology, and I direct the Center for Foodborne Illness Research and Prevention. And we're happy to welcome you to a webinar today on food safety impact from the COVID-19 health pandemic. Next slide, please. So for those of you who are not familiar with the Center for Foodborne Illness Research and Prevention, or CFI, we are a center within Ohio State's College of Food, Agricultural, and Environmental Sciences, and our goal is to coordinate food safety efforts and facilitate collaborations across OSU, Ohio, and beyond. Really, we focus on bridging the gap between science and food safety policies and practices. Our vision is a food system that consistently delivers safe, affordable, and nutritious food to all. And our mission is to advance a stronger, more science-based food safety system that prevents foodborne illness and protects public health. Next question, please. Or next slide, please. Okay, so our objectives, I'm not going to go through all of them because we do have a great panel today and I don't want to use up too much time, but they're listed here and you can also find them on our website. But just briefly, we encourage, facilitate, and promote research that aims to increase our understanding of foodborne disease and advance science-based, risk-based solutions to food safety challenges. We also focus on translating and communicating that science, raising awareness around the scope and impact of foodborne disease, building strategic partnerships and connecting different stakeholders from across the food safety system with the goal of preventing foodborne disease. And as I said before, integrating systems-based approaches to food safety that also recognize the co-benefits of food safety to food security and nutrition. Next slide, please. So today's webinar is being held in celebration of World Food Safety Day, which is on Sunday, June 7th. And that is sponsored by the United Nations. The United Nations established World Food Safety Day, and it will be June 7th every year, last year in 2019, with the aim of drawing attention and inspiring action to prevent, detect, and manage foodborne risks, ultimately contributing to food security and human health, economic prosperity, and sustainable development. For those of you that know, the United Nations has several sustainable development goals which are related to food safety. And World Food Safety Day came about after the release of the World Health Organization Global Burden of Disease Estimates. The tagline for World Food Safety Day is "Food Safety, Everyone's Business," which is really important because that reflects that food safety is a shared responsibility from farm to fork, and I say to physician, because the public health system and medical communities are really part of the food safety system as well. So in today's webinar, we have 4 great speakers who I'll introduce in just a moment. And these speakers were selected because we wanted to cover the different impacts of COVID-19 on food safety at the state and local level. And so each of the speakers is going to talk about the role of their organization and how COVID-19 has affected their roles in food safety. Each speaker will present for about 10 minutes, and then we're going to end the webinar with a 15-minute Q&A session. If you aren't already aware, this webinar is being recorded. The attendees are on mute, but you should be able to click on the Q&A button at the bottom of your screen and enter a question. Enter a question in the chat box. Can everyone hear me fine? I see there's a question about me speaking up. I'll see what I can do about that. So in any case, next slide, please. Let me see if I can turn it up. In any case, we have 4 great speakers, as I said. Jamie Higley, he is the administrator of the food safety program at the Ohio Department of Health. He's been there since 2011 and has a bachelor degree in environmental health science from Ohio University. Terri Gerhardt is the chief of the Division of Food Safety in the Ohio Department of Agriculture. Garrett Guillozet is the division manager for food safety and school health at Franklin County Public Health. He earned his bachelor's degree in biology from Ohio Northern University and has a master's of public administration and public health policy from Kent State University. He is the current past president of the Ohio Environmental Health Association and treasurer of the Ohio Public Health Association. And he is a board member on the Ohio Public Health Advisory Board. Okay, our final panelist is Laura Morrison. She is the managing director of membership and employer food safety within the Ohio Restaurant Association. She has a BS in human resource management and is a graduate student pursuing a master's of education in education and human resource studies. Laura has 20 years of experience with the Ohio Restaurant Association and focuses on association member engagement, partnering with Ohio's restaurants and food service operators to mitigate risk and enhance their food and employer safety efforts. With that, I'm going to pass it off to our first speaker. And I just want to say thank you very much to all 4 of them for participating today. Jamie, I'll turn it over to you.
Thank you. Can you hear me okay?
Yes.
Okay. Thank you for asking me to join this webinar today. I appreciate it, the opportunity to speak. Today I'm going to speak a little bit about the Ohio Department of Health, our food safety program and what we do, and a little bit about what we're doing now during the pandemic. So our normal program duties are we conduct surveys of local health district food programs to ensure they're enforcing the administrative and revised codes in a proper manner. We provide technical assistance and guidance to local health districts as well as the food industry and the public. We offer training to local health department sanitarians. We administer the certification and food protection program, which includes us approving certification courses as well as the providers. And then we also certify individuals that complete a manager food safety course and exam. We collaborate with the Ohio Department of Agriculture to adopt the Ohio Uniform Food Safety Code, which is based on the FDA Model Food Code. And then we also provide guidance and technical assistance for foodborne illness investigations. We work with the local health districts as well as other state and federal agencies to ensure these investigations are held and provide any assistance there that's needed. The Department of Health, Ohio Department of Health has a Bureau of Infectious Diseases that will offer assistance to the local health departments on these investigations, conducting interviews, things like that, collecting, making sure that they have kits for samples and things like that. And then our agency also has a lab that will test food samples and vomit and fecal samples that are involved in an investigation. So those are our normal program duties. Many of those are delayed due to the pandemic. There is currently a limit on state travel for state employees. We typically have field staff that go out and do the surveys and do training with locals, and so since travel is limited, those duties have been delayed for now. But we are still participating in many of our duties. For example, certification program, we're still continuing those duties and providing technical assistance to the local health districts and others. A good bit of our technical assistance and guidance right now is related to COVID. a lot of people have questions about, especially since in Ohio, the restaurants are just now starting to offer dining again. We're getting a lot of questions about food safety and the director's orders for restaurants and bars and other food facilities so they can operate safely. I also have some of our staff are working. Our agency started a COVID call center back in March. And so that call center is still ongoing and is still receiving a lot of calls from what I hear. And I do have a couple staff that are assisting with answering calls in that call center. Another thing that's changed is all of our staff are working from home. So, our primary communication right now is through email. But we're also, we do get some phone calls still and through webinars and other, other types of communication electronically. I have also been involved in some advisory groups that were developed by the governor's office. For the one group was for the restaurants and bars. And Garrett also participated in that group as well and some other local health district representatives, as well as representatives from the food industry. I felt very honored to be able to take part in that group. We developed a proposal for restaurants to begin reopening and provided that proposal to the governor's office. And as I said a few minutes ago, restaurants in the past few weeks have been able to reopen and again allow outdoor and indoor dining. That group continues to have weekly calls and to discuss any issues that are ongoing and to provide maybe some solutions to those issues. And I feel that's a very good process. I think we're able to provide some guidance and additional clarification on those issues. So that's mainly what we're doing during the pandemic. One thing I don't want us to lose sight of, though, is while everything right now is focused on COVID, I think, we don't want to lose sight of food safety in general. I think there's obviously people are still purchasing food, they're still going out to eat. So, excuse me. So I think there's still that food safety risk and food safety standards that need to be followed. So, I don't want us to lose sight of that as well. I do think because of the pandemic, though, some things are being enhanced. For example, employee training, cleaning and sanitation, protocols for hand washing, things like that. So, so that is one positive, I guess, is that some of these food safety procedures are being enhanced during the pandemic. So that's basically kind of what we're doing at the Department of Health and some of the duties that we have and is continuing on during the pandemic.
Okay, thank you very much, Jamie. We
Are
will
we taking questions now, or are we going to wait till the end?
I think we're going to wait until the end, Jamie. I think that's a bit easier. And then
Sure.
Because sometimes I find that questions span multiple panelists. So we'll take questions at the end.
Sounds great.
Next, we'll move to Terri Gerhardt with the Ohio Department of Agriculture. Welcome, Terri.
Thank you. Good afternoon, everybody. We at ODA Food Safety, we have the same responsibility for local health departments that ODH does. However, ours focuses on the retail food establishments, which are grocery stores, convenience stores, that type of thing. Just as ODH, we are not conducting any surveys currently due to the COVID issues. However, we have been offering some online trainings. We've offered 5 online trainings, and we've had just over 1,000 participants for those 5 trainings. So that seems to be doing well. That will probably be continuing for a while with the limitation of 10 people at a time. So this is allowing us to still provide some training to health departments, and we've done it through Skype, and now we're using Microsoft Meetings, and it's been very well received. One thing that we are doing that ODA Food Safety has responsibility for is inspecting all food manufacturing, food warehouses, and distribution centers. We also have oversight of all over-the-counter drugs, cosmetics, dietary supplements, and hemp products, the production of and the distribution of and warehousing. We also have a produce safety program that regulates the growers of produce that is usually consumed raw. And we just got word from the FDA that we can begin that program again. They had put us on hiatus during the COVID crisis for that one. We have 6 statutes that provide our authority to have oversight of food, drugs, cosmetics, and everything else in the state of Ohio. The main one is our Food, Drug, and Cosmetic Act, which actually mimics the federal Food, Drug, and Cosmetic Act. We also have an egg law, a bakery law, a canning bottling law, a cold storage freezing law, and a hemp law. And then from there, we have 18 rules that will magnify and tell us how we're going to apply those laws. So there are things like good manufacturing practices, acidification of foods, low acid canned foods, juices, seafood, shellfish, to name a few. We have been conducting inspections all along. The governor felt that food safety is a critical part of the state responsibilities. So all of the Department of Agriculture has been operating as normal, as close to normal as we can get during this time. We have developed protocols to address the COVID issues, along with wearing masks and social distancing. Initially, we started calling from the parking lot. All of our calls, unless it's an initial inspection, we don't announce, we just come. But we started to call from the parking lot to see, does the firm have any special policies, procedures? What door should we be entering through? Whatever. And from there, we expanded that to start to schedule our inspections, because we were finding that many firms were working on skeleton crews. And so to ensure that the people we needed to meet with, a lot of quality control managers were operating from their homes. Both the firms and us wanted to ensure that the correct people were there to save us all time and effort. So we started scheduling in advance. We did have a few rejections or denials of entry. That was fine. We said we understand their concerns, especially for some congregate living sites, that we would come back at a later date. As of next Monday, we are ending our call in advance. And except for congregate living sites, we will not being allowed to be denied entry. If we are denied entry, we'll just go through our regular enforcement procedures, but that rarely happens. We have run into, because of COVID, firms that are closed, and it could have been from a multitude of reasons. We don't really know because they were closed. Could have been for concern for their employees, lack of employees. It could be that they lost their market. We were able to document a little over 100 firms that were not operating during this time. And again, those were just the ones we went to. It's not as if the firms called us. We have oversight of approximately 3,600 firms in the state of Ohio. So 111, and those tended to be our smaller facilities. A lot of them were in restaurants that do canning. And I think because the restaurants were shut down except for carry out, they weren't going to be doing other things, or they may not have been open at all. Since March 16th, which is our stay-at-home time began, through June 3rd of this year, we have conducted just under 1,300 inspections. We've been busy. We've put on quite a few new firms. They range in size from small egg or home bakery to decent sized manufacturing or distribution centers. We are continuing. I know our dairy division and our meat inspection division have also been conducting their inspections. There's been no change in that. Again, just to reiterate, we're considered, essential services to provide. One of the biggest questions we always got when we'd show up at the beginning of the COVID crisis was, why are you here? And we would say, well, are you in operation? Well, yes. I said, that's why we're here. We have found through years of experience that when employees or businesses are under stress, undermanned, that's when the wheels of the bus fall off. And it's more important than ever that we have a presence out there to ensure that proper procedures are being followed to provide a safe food supply for everybody. So that in a nutshell is what we do. I'll answer any questions after everybody goes through. Thank you very much.
Thank you, Terri. I greatly appreciate that. Our next speaker is Garrett Guillozet, and I apologize, Garrett, if I mispronounced your last name. But Garrett's with the Franklin County Public Health Department. Welcome, Garrett.
Great, thank you for having me today. I'm going to talk about what the local role has been in regards to food safety during the COVID-19 pandemic and response. So next slide, please. So essentially we focused, there were three things that occurred during this pandemic that we continue to operate under at this time. So the first are alternate roles. Nearly 50% of all of our operations within our jurisdiction ceased operating under various forms of the director's public health orders. So as such, our operations, our own internal operations needed to be changed in response to the pandemic. As cases continued to increase, many of our staff were reassigned other roles to the department. So due to a steep decrease in the need for inspections due to businesses not operating, many staff were activated in various roles. Many of these included changing from sanitarian to contact tracers, forming compliant strike teams, and to leadership roles within our own incident command structure as the pandemic started to unfold in our jurisdiction. The second thing I wanted to focus on was the education part. So I think for all the sanitarians on the webinar today, we can agree that our most important role is to provide education. So in light of this pandemic, we quickly worked to create new guidance and education tools to provide to our operators. The primary principles of food safety did not change during this pandemic, and they still have not changed. We needed to really reinforce that hand washing and employee health guidelines were vital to ensure that staff and patrons were protected against COVID-19 spread. So during this process, our sanitarians provided on-site consultations and training for operators to really help them understand how they may need to alter their food safety practices based on what they were doing or were allowed to do under the specific orders. So many businesses pivoted. Many businesses started delivering more food. They started storing more prepared food for carryout. They started selling bulk produce and protein and meat items. So our staff met with these facilities. We worked through these new processes with them and provided them guidance on how these procedures could be done safely and how they could comply with the food code and the various director's orders during the pandemic. So the last section I wanted to touch on was inspections and investigations. Our general mission, which is to ensure food safety across our jurisdiction, did not stop during the pandemic. we continue to investigate all foodborne illness and general food facility complaints. Those did not stop. Businesses were, still operating in limited capacity, but complaints from the public still continued. So in regards to overall complaints regarding the director's order, many of our staff were involved with enforcing the orders and responding to the complaints. So at this time, since the initial stay-at-home order, we've received and responded to nearly 1,300 complaints. I would say the vast majority of those complaints were in regards to social distancing concerns and face coverings. During each of these investigations, whether it be phone call or an on-site visit to the business, we often found operators who were confused about the orders, the new requirements, things that they needed to do to ensure their own safety. So more often than not, we provided education and guidance. For the few repeat offenders, we initiated enforcement action, which either resulted in a notice of violation or a cease and desist order. So as businesses began to reopen, we continue to make sure that operators are complying with the applicable orders, as well as the food code laws and rules. So we continue to interpret these Dine Safe Ohio orders and guidance to make sure that businesses are doing what they need to do to protect themselves and the general public. And 99% of the time, businesses want to do it the right way. They want to comply. And so for us, it's just really working through the education and guidance piece to make sure that they understand some of those requirements. You can change to the next slide, please. So a lot of the requirements that came about from the Governor's Restaurant Advisory Board had to do with really education, guidance, and notification. So we worked really closely with our graphic designer and our communications team to provide all of the signage that these food operators would need. So this is an example of our "Do not enter if you are sick" sign, which meets the requirements of the symptom list for COVID-19. So we created these, we pass them out, we continue to pass them out. They're free to our operators. As a member of the Restaurant Advisory Board, we felt that the food code really addressed a lot of these concerns that were presented by COVID-19. We're fortunate in Ohio to have a very robust food code. It is relatively up to date. So many of our operators were already having employee health agreements. They were already required to have training. So a lot of the initial conversation and points that we discussed on the advisory board were really addressed by the food code. So we should be fortunate for that. So the last part is really, understanding the impact of the pandemic on the operators. So many of our food businesses have seen a decrease in staff. They've had to lay people off, change their business operations. So this is currently a vital time to ensure that we reinforce the necessity of adequate food safety training for all of the staff members at the operations. As new employees begin to be onboarded in large numbers, we want to ensure that staff are trained in proper food safety practices to really help reduce the likelihood of possible foodborne illness. So you could change to the last slide. So again, just some examples of some posters. We have gotten a lot of questions and complaints about, oh, the cashier wasn't wearing gloves, or this staff member wasn't wearing gloves. And so the advisory board had a lot of discussions, and Jamie would agree that we really wanted to reaffirm that the food code addresses the food safety issues around glove usage. So people who don't directly handle ready-to-eat foods should not be wearing gloves. They should be practicing safe hand washing, making sure that that's occurring frequently as required by the food code. So these are just some examples of some posters and stickers that we had made up that we pass out to our operators to really continue to make sure that we are partnering with them to allow them to be in compliance and to really help them be the best operation they can to comply with those issues. So That's really it for my presentation. Our staff has been outstanding. I think that, I would give a shout out to all sanitarians across the state because we do one thing and we do it well, and we are all adaptable. And anytime there's a situation like this, we are often the front line on interacting with the public and addressing compliance issues. And so to really live into this time across the state, I think all health departments have done an outstanding job with that.
Thank you very much, Garrett. Our next and final speaker is Laura Morrison from the Ohio Restaurant Association. Welcome, Laura.
Thank you so much for having me today. So my role today is to provide you with information from a restaurant and food service industry perspective as a member of the Ohio Retail Food Safety Advisory Council and part of the Ohio Restaurant Association. COVID-19, the reaction to this pandemic has had a massive impact on the restaurant and food service industry. A little background on the industry. Nationally, pre-COVID-19 shutdown, so just a few months ago, in reality, the restaurant and food service industry supports more than 21 million jobs and generates over 2.5 trillion in economic activity annually along a national supply chain. In Ohio, the restaurant and food service industry itself supports over $24.2 billion in sales, 585,000 great employees, and boasts over 22,500 locations. Lots of stats for you. The impact of COVID-19 with the stay-at-home orders has hit no industry harder than the restaurant and food service industry. Currently, restaurant recovery is far from certain, with an estimated 4 in 10 restaurants still closed and 2/3 of all industry employees laid off. Next slide, please. The restaurant industry functions in a normal business climate on razor-thin margins, operations, and cash flow. Our workforce is more diverse than any other sector in the economy, with more women, more diverse managers, and ownership. The industry is a leading second chance employer for those re-entering the workforce. 90% of restaurant and food service establishments are small businesses with fewer than 50 employees, and the average cash reserve is just 2 weeks. These facts bring about opportunities and challenges such as employee turnover. It affects every aspect of a food service business. Limited time, money, and resources. Barriers such as English as a second language, systems and cultural differences from the expectations and regulations required in Ohio and on the local level for food and employee safety. Misinformation and differences in rule interpretation cause undue challenges for restaurants, especially when they have multiple locations, or if the rule for one restaurant in the community is not applied to others in the same area. Education and consultation is a major opportunity. And we have worked together with sanitarians throughout this process, and we thank them very much in the state of Ohio for that opportunity and for that partnership. Opportunities include a hands-on approach of ownership and management with an eagerness to comply with rules and regulations. Next slide, please. Restaurants support a diverse and interconnected supply chain. The restaurant industry's share of the food dollar annually is 51%. COVID-19 crisis, while a pandemic, yes, it is also a food safety and food insecurity crisis. During COVID-19, we've seen steep unemployment coupled with closures of the largest source of food for many people, restaurants. Specifically in rural areas and food deserts where restaurants may be the only source within walking distance. Some restaurants have been unable to stay open because their sales have declined so sharply that they cannot pay their bills, let alone restock their perishable and business necessary items. The effects to the market, the supply chain, are high when restaurants suffer, as the industry is a massive producer of goods and services for these segments. Next slide. During COVID-19 and the continued aftermath, we've seen the supply-demand swing from the restaurant segment to the grocery segment and has struggled to rebound due to some bottlenecks along the supply chain. The outbreaks of COVID-19 and processing plants and the impact of stay-at-home orders have impacted the supply chain greatly, causing shortages and choke points in production in some cases. Another shift is, and one that will continue to be challenging, will be the resetting of the supply chain once restaurants across the nation are fully open. While Ohio as a state is open, there are continued closures or lessened hours in restaurants due to lower confidence by restaurant operators to be able to reset their stock and the ability to sell it due to lower consumer confidence. The information supply regarding rules and regulations stipulating mandatory requirements that operations must put in place and how guests are able to partake in the restaurant dining experience has been and continues to be a most challenging aspect of operations. This creates a challenging health and safety environment within the restaurant food service supply chain. Regulations over the past 2 months have been ever changing, sometimes multiple times per week. It takes time to digest the information, pivot to implement the changes, train staff on the changes, all while operating at a fraction of the revenue restaurants previously had incoming. The challenge of executing a restaurant or food service business in a constant rule-changing environment with limited tools and resources at their disposal, hiring and rehiring staff, all while seeing to the multitude of other aspects of running a business creates a very stressful atmosphere. Next slide, please. Restaurant and food service operators are resilient, and many are opening back up with plans in place, yet are continuing to be challenged by uncertainty, limitations, and costs. Some perishable and necessary business products have become unavailable or just very costly to purchase. Items such as proteins and cheese, items such as personal protective equipment or other items required for restaurants to have in stock in order to remain open. For example, we've seen hand sanitizer selling for $35 a gallon. In some cases, it's just untenable to operate. Next slide, please. Having an organization such as the Ohio Restaurant Association, partnering with regulatory agencies such as health departments across the state to bring the latest information and resources, providing scenario-based education to help put into perspective the ways to execute on the regulations has given many operators the ability to keep running their business. As a nonprofit trade organization, we have the ability to partner with many regulatory and private agencies, including ones that can provide donated goods that may be hard to find or are extremely costly. Helping small business operators in these ways provides unprecedented relief system for them. When it comes to information challenges, having one location, one resource for operators to find the latest information has made the information influx easier for companies to understand, act upon, and implement. Next slide, please. Food safety, health safety, and mitigating risk have much to do with the end user, the restaurant operator, the manager, the prep cook, the chef, the server. Making the right choices and right decisions in training, safety expectations, and accountability. Much of that lies with the operator of any food service facility, yet everyone must take responsibility for their actions. These are just a couple of the things that we've done recently as far as webinars, signage, just to keep our restaurant operators in the know and knowledgeable. For the past 3 months, we have actually put out a daily memo every single day, except for a couple of times on the weekends up until recently, and it has been a lifeline for restaurant operators. Next slide, please. So it does take a village. It takes us working together, and it takes us partnering, training, protecting, and promoting the food service industry. Next slide, please. And you can move on from that one, I'm sorry. Thank you. At the same time, food safety and health safety also lies with the consumer. Public service announcements such as the Ohio Restaurant Promise, a promise made between the operations or employer side of the equation and the consumer or guest side of the equation, is essential. The Ohio Restaurant Promise gives everyone an outline of what the rules and requirements are and how to partake in a dining experience within an establishment. Food safety has many components, from farm to table, from table to home. The restaurant industry and consumers play an important role, whether it's receiving, storing, preparing, cooking, holding, serving, or for guests to consume at home through carryout, delivery, drive-through, or curbside pickup. Each aspect is important, each role must be considered, and there must be an educational component for each to be successful. After all, food safety is everyone's business. Thank you.
Thank you very much, Laura. So that concludes the presentation portion of our webinar, and now we're going to open it up for Q&A. If you haven't already done so, you can type your questions into the Q&A box, which we're going to be monitoring. And I have some, we have some questions that were actually also submitted in advance. I think one of the really important things that each of the speakers brought up is and reinforces is the idea that the food safety system is very complex, and it does really, it's everyone's business. It's a partnership. We have to all have different responsibilities. And I think there's been quite a bit of attention on food safety at the federal level, but most of the food safety efforts really in response to the pandemic are happening here at the state and local level. And in public health, you always hear public health is local. And so that's one of the reasons we wanted to have this webinar and focus it on state and local. So the first question, and I'm going to go, I'm going to ask is really to Terri from ODA. And we've gotten a couple of questions in advance, as well as I think one just right on in the chat box is anyone testing livestock or food for COVID-19 at the government level? Because, you know, there are some questions. We know that current evidence suggests that COVID-19 is not transmitted via food, but the questions are related to whether or not livestock are being tested for COVID-19, whether food is being tested for COVID-19, and particularly in meat, dairy products, eggs, and so forth. Terri, can you potentially address that?
Yes, yeah, I can address that. I did talk to Dr. Forshee, who's the state veterinarian headquartered out at ODA, and there is no testing of animals. The CDC, USDA, state vets, no one is testing animals. Animals do not shed the virus, so it's really a waste of resources. And in this time of COVID, those are resources that are badly needed for the humans. As far as I know, there is no food testing. Again, there's been no documentation of transferring the virus via food to individuals. You know, COVID is a respiratory disease. It's not a gut disease. And when you eat your food, if it did happen to be in the food, the acids in your stomach, we're going to take care of any viruses that might have been on there. How's that for right now?
Good, thank you. Do any of the other panelists have any comments?
This is Jamie Higley. I would just say, along with, just like Terri said with the ODA lab, the ODH lab is not testing for the COVID virus either. As Terri stated, it is not a foodborne illness. So the ODH lab is not testing for it either.
Hey, Garrett or Laura, do you have any comments on that?
No, I think Terri and Jamie got it taken care of.
Okay.
Agree.
Yeah. Okay, great. So the next question that we have in the box is, since food production was designated an essential function during the pandemic, how have the regulatory agencies and the industry, and this would be for all of our panelists, dealt with protecting workers and inspection personnel during the pandemic? Let's tackle that one first. We also have just kind of here as well. We have a couple other questions that are a bit related to that. You know, how are the agencies and the industry handling facial coverings? Are there buffet service guidelines being set up? Are there any special considerations for school and for food service systems? I know that's kind of a broad question at this point, but let's tackle protecting workers and inspection personnel first. Anyone want to take a stab at it first?
I'll go first, since we've been doing this all along. We do monitor our employees daily, determine if they have COVID symptoms, whatever. If they have anything, they don't go out. Hand washing is our friend. We wash our hands constantly. When you enter a firm, maybe during the firm, at the end, hand washing is our friend. I saw a bumper sticker I've been doing hand washing before it was cool. And that's regulators. We've been washing our hands well before this started. We all wear a mask, maintain the 6-foot social distancing. We also are not touching any equipment. In the old days, 3 months ago, we would have lifted a huge kettle lid to see what it looks like inside. We asked management or whoever is with us, please open that. I need to see inside of it. So those are some of the things that we're doing to protect not only our workers, our employees, but also the employees at the facility. And then whatever else additional requirements they may have, we are more than happy to comply with them. So that's what ODA Food Safety is doing.
Thank you.
I'll take a stab at the other piece of this, or the first piece. So talking about regulatory agencies, not that piece of it, but the industry and how it's dealing with protecting workers and inspection, the different personnel during the pandemic. So in Ohio, there are some very great rules on this, a great outline that the Restaurant Advisory Group put together. And it's very specific. So the restaurant industry, they take it very seriously with rule following and want to comply because they know they want to protect their employees and also their guests. So they are meeting those requirements. It is a very difficult situation to do so, but it is one that is necessary. So for instance, businesses must require all employees to wear facial coverings except for, and then there are several reasons that are exceptions. And so those are some of the things that they are doing to protect their employees. They're definitely implementing the social distancing, the heightened cleaning of services, hand washing, sanitizing, and also monitoring. So in addition to that, they're following the monitoring of health-related issues that an employee must have. And that's really no different than they normally do, according to the Ohio Food Code. They normally have to monitor for different illnesses, or the employee has to tell them if they're experiencing different symptoms. So this is one more way that employees have to report what they're doing and how employers have to monitor that. So.
Okay, thank you. Garrett, did you have any thoughts or comments you'd like to add?
Sure. So our staff are doing a lot of what Terri indicated her team is doing during their inspections. We continue to do inspections. Our staff are required to wear face coverings, ensure that we are, washing our hands as much as we can, and making sure that we are interacting in a safe way with the employees of the facility as we do those general food safety inspections and respond to the COVID-19 complaints as well.
Okay, great. Thank you. So we also have a couple of questions about meat and poultry in particular. As we know, there's been some very large outbreaks of COVID-19 in meat and poultry establishments across the country. And so one question is, have the state inspected meat plants experienced an increase in production due to choke points that have developed with some of the larger meat processing establishments? And then there was a second question kind of related to that, is how have meatpacking plants and food processing facilities been affected in Ohio? And Terri, would you be able to address that?
Yeah, I've been working on the ag work group with the EMA, so I have actually been up to date on beef and pork. Ohio inspected facilities, and as far as I know, all the USDA facilities within Ohio have been operating. They have increased production. I know mostly those are at the ODA locations. They're open more often. They're doing more slaughter. We have not had any incidents like they've had in Iowa. We've had issues with getting our hogs to slaughter. There might be some beef that are being held a little bit longer, waiting to get into some slaughter facilities, but there's not been a problem. When they've needed a market, Ohio producers have had one. What was the second part of your question?
So the second part was, how have meatpacking establishments and food processing facilities been affected in Ohio by COVID-19 from a food safety perspective?
We've had various facilities that have had ill individuals. They've been on top of it. They're dealing with it. It's not a food safety issue directly. However, it is an operational issue. And if you don't have enough employees, as we saw in some of the slaughter facilities, it's very hard to continue your operation. We haven't had that problem here in Ohio. No firm has had to shut down that I know of because a manufacturing facility, they didn't have enough employees. That's not true around the country, but Ohio has been blessed in that manner, and we're continuing to move forward.
Okay, great. Thank you. So then there were some that were related to retail food locations, and I was hoping maybe Garrett and Laura and Jamie could answer this. Are there any formal recommendations for retail food locations and using reusable grocery bags? I know that's something that's happened. And I've gotten a lot of questions also recently about buffets and how should those be handled during the pandemic.
I can take the reusable grocery bag question. We are recommending that those not be used during this time. I think the operator wants to make sure that as they bag their items, whether it be exposed food or packaged food, that they're putting them in a clean container to limit exposure to their staff. So we are recommending that those not be used both at retail facilities and at farmers markets. So we prefer clean, unused bags for that purpose. So there will be a time when we get to start reusing those. We understand that there's an extreme environmental impact, but right now I think the main concern is limiting the spread of COVID-19 and person to person as well. So Jamie, do you want to handle the buffet question, or Laura chime in on the bags?
Yeah, this is Jamie. In regards to the reusable bags, we haven't issued any formal guidance on that. Terri might be able to provide some more input on that as well from the grocery store standpoint. In regards to buffets and salad bars, the Dine Safe Ohio order says that salad bars and buffets may operate. However, the food has to be served by staff. This is to reduce contamination of utensils. When you have self-serve areas with utensils, you have multiple people touching those utensils, touching the food, and that kind of thing. So to reduce that risk, salad bars and buffets, the food has to be served by the staff.
Okay, thanks, Jamie. Laura, before you add on to that, well, go ahead.
It's fine. So really just adding on to that, it is interesting to walk people through this, and that's really the rules. So the rules have been set. They do change sometimes, they fluctuate. So it's constantly looking for making sure that we have the most up-to-date information, because we're fielding just, I would say, thousands of calls all the time. One of the questions in the chat was, in the question answer was, what keeps you up at night? The need from questions is what keeps us up at night, because just walking people through how to think about what their setup looks like, what their organizational structure will continue to look like, and how they will actually serve people. They're on a short, shoestring budget many times. So you've got some issues with having to increase staff, and finding people, training them. That is always a challenge in the industry as well. So, making sure that these items can be served rather than have them be self-served is key.
Yeah. Well, actually, that was one of the questions I was hoping that the panelists could address, along with the second question from Joan on that, which is, what does the new world for each of your organizations look like post-COVID-19? And so maybe each of you could talk a little bit about what keeps you up at night, and how do you think your organization is going to evolve going forward?
Well, I'll start. This is Terri. It has changed for us in that the procedures that we utilize during our inspection. However, we're still doing the same work. We're still protecting the public. We're providing guidance to industry. That's not going to change. I think the method in which we conduct our inspections, with the social distancing, the mask, not touching things, will continue far into the future, especially with a vaccine. Unknown how far widespread it will be utilized. I think that might be the same norm, but our basic purpose in being out there to protect public health and protect the food supply will continue without major alterations.
Okay, great. But Terri, what keeps you up at night?
Foodborne illness.
Okay, great, thanks. Garrett, do you want to take a
Sure.
chance?
Our new normal, I don't think we yet know what that's going to look like. So, we continue to do inspections, but as COVID-19 continues to evolve and affect the economy and our own staff, we realize that we at Local Health will be the lead in any future vaccination efforts that will come down the pipeline. So we are gearing up, planning initial stages for those vaccination deployments and mass vaccination clinics, and that will be an all hands on deck. But I think that is still yet to be determined what that time frame is. But knowing that it will be coming at some point is sort of just being mindful of that. What keeps me up at night, a foodborne illness or another disease outbreak on top of COVID-19, knowing that many local health departments across the state are already strapped with employees and staffing issues, and trying to maintain that minimum capacity. It's a factor that I think is true for many of us in regulatory functions, but that's definitely a concern that I have, making sure that we're taking care of our staff so that if there is a situation, we have people available and rested up to address those issues.
Okay, great. Jamie?
So for ODH, it's working from home has been challenging. We don't do any direct inspections. So some of my staff that travel a lot, have had to work on other for example, as I mentioned during my talk, was, a couple of them are working at the call center. And so we've had to shift our focus, on some of these, for some of our duties. It's not known at this point when we will return to the office. So, it's been challenging to say the least. What keeps me up at night? Probably a little bit of everything, adjusting to the new world right now, doing our best to protect public health. Foodborne illness, as Terri and Garrett had stated, was, the risk is still there. So it's kind of, in the background right now, but we still, can't, as I said before, we can't lose focus on that. And just, protecting myself, protecting my family as well. It's scary.
Yes, so thank you. We're at 1 o'clock. We have a lot more questions still to go through, but our time is limited. So what I will say is that we will do our best to try and put together and respond to some of the questions that we've gotten here, and we'll touch base with our panelists to see if they can provide additional answers as well. I think that there were quite a bit of interest in and different questions that people had. And I want to thank all of our panelists for participating today. I really hope everyone learned a lot. And I want to thank the attendees for joining in. You'll probably be getting a quick survey in the future about the webinar, and give us some feedback and some future topics. But again, thank you very much. Food safety is a really important topic, and it's especially important right now. So thank you all. I appreciate it.
Thank you.
Thank you.
Thanks.
Thank you.
Have a great day. Bye.
Bye-bye.